Hi, I'm Garvin. Welcome to another telehealth information video series. In this video, I will give a brief overview of what you need to know about arthritis. And in particular, I will cover what is arthritis, how do you treat arthritis, and how can you best live with arthritis. So first, what is arthritis? Arthritis is inflammation of one or more of your joints, such as one or both knees or wrists, or a part of your spinal column. The two most common types of arthritis are osteoarthritis and rheumatoid arthritis. Joint pain and stiffness are the main symptoms of arthritis. The most common signs and symptoms of arthritis involve the joints. Depending on the type of arthritis you have, your joint symptoms may include pain, stiffness, swelling, redness, decreased range of motion. So some types of arthritis are accompanied by signs and symptoms involving other parts of your body. These symptoms may include fever and fatigue, rash, weight loss, breathing problems, dry eyes and mouth, and night sweats. So the risk factors for arthritis. The first one would be a family history. So some types of arthritis do run in families. So you are more likely to develop arthritis if your parents or siblings have the disorder. Next would be age. The risk of many types of arthritis increases with age. And next is sex. Women are more likely than men to develop rheumatoid arthritis. And next would be previous joint injury. So people who have injured a joint, perhaps while playing a sport, are more likely to develop arthritis in that joint. And lastly would be obesity. So people carrying excess weight would be at risk. So the pain associated with arthritis is caused by joint damage. Joints are made up of the following parts: cartilage, which is a hard but slick coating on the ends of bones. Cartilage allows bones of the joint to slide smoothly over each other. The joint capsule. This tough membrane encloses all the joint parts, and the synovium, and this is a thin membrane, lines the joint capsule and secretes synovial fluid which lubricates the joint. So how arthritis damages joints. The two main types of arthritis damage joints in different ways. Osteoarthritis first. So osteoarthritis, wear and tear damage to the cartilage can result in bone grinding directly on bone. So this causes pain and restricted movement. This wear and tear can occur over many years, or it can be hastened by a joint injury or infection. And for rheumatoid arthritis, the body's immune system attacks joints and inflames the synovium, causing swelling, redness, and pain. The disease can eventually destroy cartilage and bone within the joint. So how do you treat arthritis? Arthritis treatment focuses on relieving symptoms and improving joint function. The medications used to treat arthritis vary depending on the type of arthritis. Commonly used arthritis medications include painkillers. So these types of medications help reduce pain but have no effect on inflammation. And examples would be paracetamol, tramadol, and opiates like oxycodone. Next, counter-irritants. So some varieties of creams and ointments contain a substance such as menthol or capsaicin, the ingredient that makes hot peppers spicy. Rubbing these preparations on the skin over your aching joint may interfere with the transmission of pain signals from the joint itself. Next would be anti-inflammatory drugs, or Nsaids, or non-steroidal anti-inflammatories. So the Nsaids reduce both pain and inflammation. Over-the-counter Nsaids include aspirin and Nurofen. Some types of Nsaids are available only on prescription, such as naproxen. Oral Nsaids can cause stomach irritation, and some are also available as creams or gels, which can be rubbed on joints. Next medicine would be disease-modifying anti-rheumatic drugs, or DMARDs. often used to treat rheumatoid arthritis. The DMARDs slow or stop your immune system from attacking your joints. Examples would be methotrexate and Plaquenil. And lastly would be the biologics, typically used in conjunction with DMARDs. Biologic response modifiers are genetically engineered drugs that suppress the immune system, and examples include TNF blockers such as Enbrel. And then we have corticosteroids. So this class of drug, which includes prednisolone and cortisone, reduces inflammation and suppresses the immune system. Corticosteroids can be taken orally or injected directly into the painful joint. So how can you best live with arthritis? The pain and disability associated with arthritis can be frustrating and depressing. So educate yourself is the first thing you can do. Read everything you can and you get your hands on. Learn about your disease. This is usually the first bit of advice offered to a newly diagnosed arthritis patient. Next would be positive coping solutions. To rise above the pain, a person must continually focus on what they can do rather than what they cannot do. A person must devise strategies and set goals in order to continue living their life to the fullest potential. And a person must focus on remaining active and maintaining as much independence as possible. So we stock at this pharmacy lots of pharmacy products that you can buy over the counter to help manage your arthritis conditions, such as chondroitin and glucosamine, devil's claw, omega-3 fatty acids, psyllium husk, and exercise balls, floor mats, and weights, various equipment required for weight-bearing exercises. We have therapeutic putties, hand exercise device, Digiflex and Digibands, and hand exercisers. We can also supply assisted living devices such as canes, walkers, raised toilet seats, and devices to prevent falls and protect joints, grab rails, non-slip mats, and shower seats. So that brings this video to an end. If you want more detailed explanation of arthritis, you can book a brand new service we are now offering where we co-create with yourself a cohesive health management plan and where we help you to better understand arthritis and take an active role in managing it with confidence. So call into us at Lynch's Pharmacy in Douglas and Cork or call 021 436 6923 to book your telehealth clinic today. Thank you for watching. Stay healthy and stay informed.